Can I touch it to make it? 3 viewers, 7. We'll give you guys a little bit of time here to get online before we get going. Good afternoon. My name is Kaylani Scott, and I am the Communications Manager for the Nez Perce Tribe. And I am going to provide you with an update. Following, I will hand it over to Dr. Hartwig to provide some additional information. We received information today that a Nez Perce Tribal Executive Committee NEPTIC member tested positive for COVID-19. The person that tested positive was involved in the NEPTIC reorganization meeting that took place on Tuesday, June 23rd, in the Richard A. Half Moon Chambers, which lasted for over 3 hours. Since the individual was in close proximity with the other NEPTIC members for the duration of the meeting, all NEPTIC members have been instructed to self-quarantine for 10 days and monitor for COVID-19 symptoms. NEPTIC support staff that were also in direct contact with the individual have been instructed to self-quarantine for 10 days as well. However, all office operations will still proceed. All NEPTIC members are being equipped to be able to work from home.
Why'd you say that one more time? Just say it one more time, because now we have over 100. Say when they reiterate.
So just to reiterate that, we have confirmed that one NEPTIC member did test positive for COVID-19, and with that individual being in direct contact with the entire NEPTIC membership, all NEPTIC will be going under a self-quarantine for 10 days. They will also be monitoring for symptoms. If they do, in fact, start having symptoms, they will then contact Nimiipuu Health to see if testing is necessary. In addition, all NEPTIC support staff that were in contact with the positive individual are being asked to self-quarantine as well for the 10 days. This case brings our current confirmed positive COVID-19 tests on the reservation to 3 since June 23rd. It has also been confirmed that a person that has since tested positive for COVID-19 was in attendance at the recent General Council meeting. Persons in attendance at the meeting may have been exposed to this positive individual. Despite this fact, there is no need to panic. The contact tracing process will begin, and if an individual was in direct contact with a positive individual, they will be contacted with additional instructions. As a reminder, direct contact is defined as being within 6 feet for longer than 10 minutes of a positive individual. Again, we did receive the information that it was confirmed an individual who was positive for COVID-19 was at the recent General Council meeting. However, they will begin the contact tracing process, and if a person was in direct contact with the positive individual, they will be contacted and provided additional instructions. I would like to hand it over to Dr. Hartwig, and she will provide additional information on the process going on at Nimiipuu Health.
So first I want to ask for my attire. I've been home the last few days taking care of a family member, so I apologize for my hat. I first want to just remind you how the virus spreads. And the primary mode of spread is via respiratory droplets. So the criteria outlined by Kaylani with respect to close contact, so within a 6-foot diameter for greater than 10 minutes is with extensive interaction is via respiratory droplets is how the virus is primarily spread. The mask utilization at General Council was an important measure that we used or recommended to prevent spread, as well as the social distancing. I know that a lot of people had the perception that that wasn't the case, but masks were worn by the majority of the people that attended, and when they weren't used, there was significant enough space between people. So thank you for respecting that request and recommendation. How to avoid spread: covering your cough when you or sneeze with the tissue, and then washing your hands immediately after. Staying home when you're ill, not reporting. In this time of COVID, we would ask that minimal symptoms of illness remain home, which wouldn't normally happen. Let me just review the symptoms that may appear 2 to 14 days after exposure to the virus with COVID-19. So fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. With the presence of the virus back in our community, any of those symptoms, regardless of how mild, I would recommend that you present to the clinic for testing. The Nimiipuu Health is going to be conducting symptom-based testing, which means that if you have symptoms and have a probable exposure, we're going to test you to make sure that you to assess whether or not you have COVID-19, to identify and confine those infections as quickly as we can. With the exposures that we have, quarantining has been recommended, and I'll remind you that quarantine is for somebody who is not manifesting or showing symptoms, whereas isolation is a more stringent recommendation for those who we know are COVID positive. Isolation and the care of somebody with COVID-19, there are extensive directions on the CDC website, and I believe that we have a link on our Nimiipuu Health website that also outlines some recommendations that would include them having their own bathroom, using their own eating utensils. Anybody who interacts with them should have gloves and a mask, whereas quarantining is that you are separated from family but not with those stringent measures. And so quarantining has been recommended for those who have come in contact with the known positive cases in our community. And as Kaylani mentioned, the Public Health District will begin contact tracing to identify others at risk. So testing at Nimiipuu Health is going to be symptom-based for our Abbott ID Now analyzer, and that's our rapid testing machine that we can get a positive test result back as quickly as 3 minutes and a negative result back in as quickly as 15. I will share that the tests that became positive were a little bit more delayed than the previous testing, which may indicate a couple of things. One, that the viral load wasn't quite as robust or high at this juncture in the illness, which may mean that the virus is not as potent, and that's clinical speculation, I'll admit, but the stability above 55 degrees in the environment is much less for the virus. So these warmer temperatures hopefully will be helpful. I will let you know that we are in the midst of doing some broad testing in the community for asymptomatic people, just because of the venue that the exposures have occurred. I wish that I had that all outlined before tonight's Facebook Live showing, but I will get that out when we have the details outlined and everything is set, because we have requested assistance from testing supplies from the Public Health District, as well as from Benoit. They've graciously provided us with 100 test swabs that we will utilize, and 500 have been requested from the Public Health District for us to set up some extensive testing for our community members, so that we can get an idea about what we're facing. And we did something similar with our first cases. We tested patients outside of that testing criteria of symptom-based testing, just to get an idea. And as a reminder, we had some asymptomatic, which means patients without symptoms, test positive, and so we want to get an idea about that to see if that's the case. This was a travel-related exposure that seems to have brought the COVID virus, and it wasn't out of any recommendations or any disobedience, because open travel is accepted both in our community and in our state. So it was a planned trip where the exposure occurred, but that just reiterates kind of the need for us to be diligent with hand hygiene, with social distancing, with mask utilization when you're out in public, particularly when you don't have control of your environment. It's just important for us to maintain those measures to help protect our community, especially those who are most vulnerable.
Dr. Hartwig, can you provide some instructions for folks that did attend the General Council meeting?
So I described the contact tracing that's necessary as a pebble that's dropped into a pond. The pebble represents the person who tested positive, of which we have 3 in our community. The first ring that pebble creates in the ripple effect from the pebble, those are the people in that first ring that have had prolonged exposure. Those are the people that we're monitoring closely to see whether or not they contract the illness or not. Not everybody, just because you had exposure doesn't mean that you're going to get the illness. The infectivity rate, we're still learning about what's the viral load that's necessary to transmit infection. Those are questions that we don't know or have answers to at this point. But that first ring that's created when the pebble is dropped, those are the people that are at highest risk, and those are who we're monitoring or will monitor closely, so that we can identify if they have symptoms or they develop symptoms, or will test positive when we have that capability, hopefully early next week. And the people beyond those, which would represent most of the people at General Council, you would monitor just like we are every day for our symptoms anyway, just because of the time that is here. We're monitoring for fever and cough and shortness of breath, all of the symptoms that may come along with COVID-19. But the majority of people that were at General Council really don't need to be concerned. We would monitor just as we would any other time, myself included, as I attended General Council.
Can you also talk a little bit about mask wear and how that helps mitigate contracting or spreading the virus?
So as I stated initially, the majority of virus spread is via respiratory droplets, and so the mask inhibits the passage of respiratory droplets from myself to somebody, but it also protects me not entirely, because any mucous membrane can absorb the respiratory droplets, which is why eye protection is necessary, mask is necessary, and a shield when you truly are in the midst of a COVID positive case or the risk of a COVID positive case. But the mask helps reduce your exposure and to those respiratory droplets, as well as reduces my risk of spreading respiratory droplets.
Thank you. And then perhaps if you could just reiterate that it's really only those that have been in direct contact with a positive individual that are at higher risk.
So those who had direct contact for that prolonged period of time, less than 6 feet diameter, for greater than 10 minutes, those are the individuals who we would recommend to self-quarantine. Again, quarantine is a non-infected individual, non-ill individual. So quarantine would be, because we know that you've had direct contact, you're at higher risk just because of that prolonged exposure. But everybody beyond that direct contact really is like what everybody does every day. We're monitoring for, our general health and our well-being.
So maybe just to wrap things up, you could give a final reminder of safety protocols to help avoid contracting the virus.
So the safety protocols that I would recommend would be that you need to stay home if you're ill, and if you are ill and manifesting symptoms, call Nimiipuu Health so that we can instruct you on how to get you tested if that's the case. Coughing or sneezing into a tissue or some barrier and then washing your hands immediately after. Avoid touching your eyes, your nose, and your mouth. Washing your hands diligently for at least 20 to 40 seconds. Those would be the social distancing, staying 6 feet away from people that you're not familiar with, and passing, such as passing in a grocery store. That's a very minimal exposure or time span, so your risk in that situation is low. But certainly using your mask in that public setting would be protective. Those would be the recommendations that I make for your safety.
And then just since we're getting a few people coming in a little bit later, can you reiterate the policy for testing and how you're going to address that going forward?
So testing at Nimiipuu Health is currently being conducted on the symptom-based method, which means that symptoms are manifested based on the criteria of fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, loss of taste or smell, sore throat, nasal congestion or runny nose, nausea, vomiting, or diarrhea. Those symptoms would lead us to perhaps conduct a test, and that's going to be the main testing mechanism for our Abbott ID Now analyzer, which gives us the rapid test results. I am currently in the process of developing a community-wide testing mechanism where we will send those tests for patients who are asymptomatic to the state to be analyzed, and I had hoped to have that completed before today's Facebook Live, but this timeline was very short. I have secured the testing supplies, and we'll have that publicized and released when we have that set up, but it will likely be early next week. The other thing that I would say about testing is that with exposure, we have to allow our bodies to manifest or to show or to mount an immune response before we can test. If we test too soon before your body has had a chance to internalize the virus. So as a reminder, viruses must multiply inside our cells. They can't live on their own. They need our DNA and RNA in the nucleus of our cells to live. And they can only replicate in that manner. their replication has to be present enough to have burst open that cell that they're using of ours to multiply itself, and then those protein particles that the virus uses to penetrate other cells, those have to be in sufficient numbers for us to be able to detect. So there is a time span where symptoms are mostly presented anywhere between 2 and 14 days after exposure. And the mean or the average time span after exposure that people are manifesting symptoms, and symptoms are when we have the highest probability of getting a positive test or detecting the virus is at day 5 post-exposure. So we want to make sure that we're not testing people too soon and allow their bodies to manifest some enough time to mount an immune response so that we can detect that a virus is present. And I know that this all seems, kind of after the fact, and we're kind of chasing a tail. I have the same frustration. If we were able to detect, a virus before anybody or any manifested symptoms, those asymptomatic people is really why we're setting up this community-wide testing, so that we can identify those who may be spreading the virus and not be aware. But the symptom-based testing, we have to give your body some time to mount that immune response so that we can get an accurate result. Because just because you have a negative test, it doesn't necessarily mean 100% that you don't have that virus. It means that that point in time that testing occurred, that you didn't have enough virus present to make the test positive. It doesn't mean that you don't have the virus. It means that that threshold was not met for the test to be positive. Well, I thank you for your time tonight, and we'll communicate with you as well as we can and as quickly as we can as we develop the plans that we need to make our community, help our community remain safe. Good night.